This one's going to be a doozy.
I don't know if I'm ready. And I said that in like a joking tone, but I kind of actually don't know if I'm ready because there's so, like, my head is swimming after 2 weeks of being like neck deep in all of this.
So immersed. For the listeners who aren't watching the video, you might just imagine the biggest dark circles under my eyes because, like you said, being neck deep in this topic has been a lot more taxing than I thought it would.
Yeah. I think it started out as like a special interest that I was like, oh, wow, this is fascinating. And now it's just like all consuming. And I feel like there's no bottom to this well. Like every time I find a fact or like find a connection, there's just more and more and more. I don't think it ever ends. I think it's a bottomless pit, a black hole.
Yes. This is the Conscious Mental Health Podcast for curious clients and conscious clinicians. This podcast is for informational purposes only and should not be considered health or mental health advice. I'm Juniper, licensed clinical social worker and mental health educator.
And I'm Laurel, a licensed professional counselor and a mental health educator.
We are here today with dark circles under our eyes because we have been neck deep in gender exploratory therapy. I'm speechless.
Truly. I will say, I think this is a really important episode and I'm glad we're doing it. I don't want to avoid having the conversation just because it seems overwhelming, but also I would give a content warning because we're going to be talking about some things that are or could be pretty upsetting, especially if you're a person in the LGBTQ community, if you're a trans person, or you have loved ones who are trans. I would just offer to take good care of yourself and just know there's going to be a lot of conversation about some tough subjects under this umbrella today.
I think we should start with the origin story of why we even got into this in the first place. What brought our attention to gender exploratory therapy that also goes by many names?
Well, as so many unfortunate rabbit holes do begin, our story begins on Facebook. If you're watching the YouTube video, you can see our beautiful board behind us. We are going to be using this as one of those, what would you call it? Investigative maps?
Yeah, I was detective string
CSI.
board. Yeah, we had to do it. So if you're listening on the pod, if you want to see the board, please check us out on YouTube. As it all started.
It started on Facebook.
On Facebook.
Mm-hmm. Thanks, Mark. So I am in a number of therapist networking groups on Facebook as a part of my job here and just connecting with people and sharing resources. And one day, I don't know, how long ago was it? A couple of months ago,
Mm-hmm.
Maybe it was even back in the spring. I stumbled upon someone requesting resources for working with a trans client. And someone had commented this resource that I had never seen, and it was called Therapy First. A couple of other folks had commented underneath that resource saying things like, please be careful. This is a transphobic organization. I don't recommend them. This is a dangerous model. It's conversion therapy. And I had never heard of Therapy First, but we're going to talk about it because they certainly are out there and very professional looking and sounding and are actually influencing a ton of public policy, both in the United States and in many other countries right now.
Yeah.
Yeah.
Hello, editing Juniper here. We just wanted to share that for this deep dive, we interviewed both clients and clinicians that have either received therapy in the realm of gender or identity, and also who have been therapists in that realm. So Nick was our client interview, and we interviewed Amy, Marie, and Megan, who are all three clinicians. And we also interviewed an endocrinologist working in the space of gender affirming care. However, after the election, the hospital that they worked at decided that they didn't want any of their physicians or employees doing any public interviews due to safety concerns. So we will share some of the resources, but we will not be sharing any of that interview to protect the safety and preference of that endocrinologist. We really wanted to offer various perspectives on the topic of gender exploratory therapy and gender affirming therapy. So in this episode, you'll be hearing again from Nick, Marie, Amy, and Megan. We're also going to share a ton of clips directly from the trainers and therapists in Therapy First and their other organizations. So we're going to share from their podcast. We're going to share from some of their webinars, and all the information that we're sharing is public domain. We're utilizing this for educational purposes. Okay, so we asked Amy and Marie if they'd ever heard of Therapy First or Gender Exploratory Therapy.
Hi, this is Marie Coma Thompson, LPCC. I have not heard of Therapy First other than Juniper mentioning it the other day, and I haven't heard specifically of Gender Exploratory Therapy.
My name is Amy Halverson. I'm a licensed clinical social worker with a focus on treating trauma. I have not heard of the organization Therapy First. I have also not heard of Gender Exploratory Therapy.
And I hadn't either. And when you alerted me to this organization, and then I started looking into it, when you first go onto the website, I'm like, okay, this doesn't feel explicitly anti-trans.
No, it doesn't. They do a really interesting job, and I think like a pretty good job of sounding very reasonable, very middle ground, like walking a neutral sort of a line, or offering this sort of comforting sounding language around why they use the model that they use. That really makes sense if that's all you see. But when you start to dig deeper, it starts to become, to me, a lot more troubling. And the front page of their website says psychotherapy as first line treatment for gender dysphoria. We're here to help.
We asked Megan to take a look at the website with us to share her first impressions. Now, reminder that Megan had not seen the website or, again, heard of Therapy First or Gender Exploratory Therapy before we looked at it here. Looking at this website, if you were a therapist looking for resources for your client or your client's family or yourself, what would you know on first glance?
Yeah, so as I look at this, I think the first thing that sticks out to me is this really bold print with this pretty glaring message that I take is that there's a problem and we need to treat it. Yeah, and then there's this, and we're here to help.
So it basically says that their aim is to support psychotherapists working with gender dysphoric children, adolescents, and young adults in providing high quality evidence-based mental health care and offer public education on mental health and psychotherapy. Just noticing that, number one, they missed a period. Get an editor. But number two, anything seem off with that? Because
I get a very like undercover operation here. Like it is not super explicit.
Yeah.
And if someone didn't kind of know what they were looking at, I think it would be really easy to fall into kind of what I foresee as like a trap.
Again, we asked Nick to take a peek at the website with us, and this was their first impressions.
So when I pulled up the first page there, of course, it's laid out quite beautifully. Looks like any other like therapy page that you might want to visit. It looks quite inviting, in fact. But the wording is so careful. Oh my gosh. And then it's so triggering. The more that I read through there, oh God, they were covering landmines. So you had to be very careful where you stepped. Not even knowing what I was looking into necessarily, just reading it, it felt very much like a trap. If you could write everything in the deepest, darkest corners in the lightest pen you could possibly write it in, that's how it was written.
I don't understand the front line treatment. That language has me tripped up a bit, but okay, yeah, therapy makes sense.
Sure.
I did work a lot with trans youth, trans adults, everywhere in between the spectrum, gender nonconforming to various stages of transitioning or not transitioning.
Mhm.
And yeah, it kind of makes sense. Therapy is a part of that.
Sure.
Therapy is a part of it.
Very often therapy is a part of it. And very often therapy is one of the first line treatments as far as if people are going to seek out medical support in transitioning. Like anytime I have worked with an individual who is walking through that process, therapy has been a part of that. Obviously, I'm biased because I'm a therapist and that's what I do. But often there is a component of needing or being required to have a mental health component of that work. So it doesn't sound unreasonable to me by any means.
And here's what Nick noticed with just the front hero page of this website and their huge tagline, psychotherapy is first line treatment for gender dysphoria.
Okay. That's one of the very first lines. Psychotherapy as first line, I don't care, whatever. Treatment for gender dysphoria. That is a huge trigger. Huge. Why are you treating me for gender dysphoria? Because, when I go to my therapist doesn't say she's treating me for gender dysphoria. I have gender dysphoria.
Mm-hmm.
She may be treating me for that, per se. That's not how she addresses it. That is awful. She's helping me through something. You're not treating me.
You're being treated for something that is wrong.
That's dirty.
Like an illness.
Yes.
Okay.
Like, what is wrong with... There's nothing...
But we're here to help.
We're here to help.
So we dug deeper.
Therapy First also is a professional association. You can join it as a professional, as a licensed mental health provider. Also, for the professional aspect, they have trainings. They have a clinician guide, which is noted up here, and we'll talk about in just a little bit, a guide for working with what they refer to as gender questioning youth. And they're actually an MBCC approved continuing education provider for licensed mental health professionals. They do have MBCC approval for any course that they should put out. So, and it's a credentialing board that approves continuing education for mental health professionals. It's a national provider. And if you get approval as an educator through them, you don't have to submit any of your trainings individually to them. You are just automatically approved as a continuing ed provider for professionals. This organization is both a place to seek out therapy and a place for professionals to find education and community and networking. They work with children and adolescents and young adults primarily. Mm-hmm. That's their big population that they focus on. They really don't focus on work with adults much at all, I don't think. And so I can only imagine as a parent, if I don't have knowledge of all of the different range of treatment options for my child, but I'm trying to seek support for my child. Maybe they just came out to me, or we've been having a conversation for a while and I'm just kind of getting online and looking for what is out there. This seems like a very supportive, very, I think, open-minded place to get started. We'll get into the reasons why, but it's very concerning to me.
They've done a very good job of being able to remain or sound neutral. And maybe that's why they've been approved by certain boards for training, because it's really hard to find direct language. Let's get more into what Therapy First is about. And in that, I'm sure we're going to start to discover some of the main therapists and people involved, and also other organizations that are connected to Therapy First. But yeah, let's get involved. Well, okay, what is gender exploratory therapy? What do they believe in? Is it a model? Let's get more into it.
Yeah. So also, we should note that Therapy First is a new name for this organization. They rebranded very recently, and they used to be called the Gender Exploratory Therapy Association, or GETA. Okay, so a lot of things that will come up if you are looking and doing research further will reference GETA, G-E-T-A, and not Therapy First. So we want to make sure that we note that those two organizations are the same thing. They've just rebranded.
The way that we are going to talk about this type of therapy is we're going to use their practice guide for clinicians.
And I took the L and read the entire clinical guide from start to finish.
And I took the L and watched the hour and some odd webinar of them talking.
It was a lot.
It was a lot. And I did have to take breaks.
Mm-hmm. So essentially, the way that Therapy First, or GETA, describes gender exploratory therapy is it's an exploratory approach. Okay. And again, I'm going to use this language, and I'm going to talk a little bit about what comes up for me with it and what I've noticed. And I think what some other professionals have noticed with it as well. So just hang in there. But they describe it as an exploratory approach, which stands in contrast to the, quote, gender affirmative approach, which they say has gained popularity in recent years. The gender affirmative approach assumes that minors presenting with a wish to live in a gender role different from their sex are transgender, and that the primary role of the therapist is to help minors transition. Transition consists of varying combinations of social transition, medical interventions, and surgical procedures. They state that exploratory therapy does not have a fixed outcome, such as identification with natal sex, as its goal. Instead, it is a patient-centered process which aims to explore, understand, and address the multiple intersecting factors generating distress in the young person's life. One possible outcome is that the individual may come to identify with their birth sex and accept their body as is, or they may decide to find non-medical ways to live a better life while still honoring their unique gendered experience, or they may decide to go ahead with gender transition and medical or surgical interventions, even if they have a greater understanding of the complex sources of their distress. These outcomes are equally valid and equally legitimate. I wanted to read that whole thing because I think it's very interesting. They put a couple things in there on purpose, right? So what they do is they set up a binary between affirmative-based therapy and exploratory therapy. So they've already created what I believe is a false binary. The other thing that they put in there very on purpose is that it does not have a fixed outcome, and that they are open to an individual seeking medical or surgical interventions. And what we're going to notice throughout our conversation today is that is patently untrue based on their further literature and case studies and the way that they approach therapy and the way they speak about their clients.
Yeah. And a lot of ways that we learned that was because we listened to their podcast. And we're going to get more into the therapists that do the podcast, but they are the therapist of Therapy First. They're the ones doing the so the webinar consisted of these therapists, Stella O'Malley, Sasha Ayad, sometimes Lisa Marciano likes to jump in there. And we listen to maybe between the both of us 10 to 15 of their podcast episodes where they're talking about how they do this therapy. So we're literally getting this information directly from the trainers. And in the webinar, they highlighted this openness to a range of outcomes. They're not trying to convince young people that they're not trans or attempting to change their sexual orientation. It's about helping them understand themselves better and find a path that minimizes harm.
Right.
Direct quote from the webinar.
Yeah. And there are many other quotes in this clinician guide that also kind of back up that I believe their statement that they would be okay with someone seeking medical intervention is patently untrue.
As a therapist, and for all the other clinicians listening, let me know what you think. But are we always open to a range of outcomes? I don't understand. They're setting this up because, again, Laurel talked about this false dichotomy between gender affirming care and gender critical care. And the idea is that in gender affirming care, there's only one outcome. Right. They believe the only outcome in gender affirming care is surgical intervention and medical intervention. However, as a clinician who has been trained in gender affirming care, the client guides the outcomes. Here is what Marie and Amy shared about their understanding and training of working with clients using a gender affirmative model.
And if I were working with a kiddo who was questioning their gender identity or wanted to work with that in session, I would just give them a space to do that, to talk through their feelings, to provide any information they may need. And I would try not to sway them either way. I would try to be really neutral about it, not feeling that being trans or non-binary is better or that being cisgender is better. I think I would just allow them the space to talk through how they felt. And I would, call them any names or pronouns that they wanted, as I would for any client. I think we should call people what they want to be called. And I would work to dispel any misinformation that they had and connect them with resources that they may need. But I definitely wouldn't push them either way. I think that's, they would just probably need a space to explore it.
My experience in offering a gender affirming model of practice, placing intention on using they pronouns anytime an individual being referenced directly or indirectly if their preference is unknown. Setting an intention in challenging assumptions of societal norms, such as hair or dress that are associated with a particular gender, colors that are associated with a particular gender, and bringing into the treatment guidance to assist the client in approaching with curiosity themselves and how their gender fits for them.
Megan shared a little bit about how she approaches working with children and families.
And I also tell the parents that I work with, your kid is the expert on themselves, and we have to begin to trust them and really listen and hear them and value their perspective, their own thoughts, their own opinions.
I don't understand why they're setting it up. Well, actually, we do understand they're setting this up in a way that is that's what therapy is.
Right.
They have this idea, and I kept trying to find research, and we'll get more into it, that's not what gender affirming care is, that it's only one outcome. So I think they're introducing this idea of range of outcomes because they believe that when children or youth are coming in, there's a pipeline that only leads to one outcome.
Right.
Did you get that?
I do. And I think that they both believe and want to express to the public that they are the ones that are open, that are truly doing therapy and are not constrained by what they very often in their literature and in subgroups that they're connected to, gender ideology.
Your sex refers to your physical body parts, remember? But there is also something called gender, which is how you feel inside your body and who you know yourself to be. And your gender, how you feel on the inside, doesn't always match the sex you were called when you were born.
Okay.
Let's say you were born with a penis and you feel like a boy inside. In that case, your sex and your gender match.
Well, what if you were born with a penis and you know you're a girl inside, not a boy?
Then your sex and your gender don't match.
Wait, what does know you're a girl inside mean anyway? Does that mean you have to love pink things and princesses?
Nope. Sometimes people refer to things as girl things and boy things, but this is just how people sometimes classify things, usually to make it easier to sell stuff to kids and their parents. Clothes, toys, and games are for everyone. You don't have to be a boy or a girl to like a certain thing. Sid, has anyone ever told you that you shouldn't play with something or wear something because you're a boy?
Well, yes.
The body parts you were born with don't always dictate who you are, how you feel, or what you like to play with.
That's such a relief.
Gender, how you feel and who you know yourself to be, tells you who you are, and there are a whole bunch of possibilities. Figuring out what feels right for you is just part of growing up.
And so it is really a false binary. And I love, there's a channel on YouTube that I really love. Dr. Jamie Talks LGBTQIA+, I think is the title of the channel. I liked how she really synthesized it so well really quickly, in that you can be exploratory and either affirmative or non-affirmative. Right. So they're setting up this binary between you're either exploratory or affirmative, when in fact, what they're doing is non-affirmative exploratory therapy. And what someone else might be doing is affirmative exploratory therapy. And that's a more accurate binary, because therapy is always exploratory, or should be.
One of the podcasts that we listened to, they were talking about how they use pronouns or don't use. And their approach that they were teaching other therapists to do is to not use pronouns at all.
What are you going to do about names and pronouns? And this can be really tricky because, of course, you never want to start a therapy relationship off in a power struggle.
No.
So you can't make this the kind of hill you're willing to die on. And on the other hand, you do want to leave space for this exploratory angle. So, I mean, for therapists listening, here's a kind of trick that I've come up with that's been really helpful. First of all, pragmatically in therapy, you almost never need to use pronouns because you're speaking with the individual, okay? And if I'm in a conversation with both the teenager and the parent, I still direct the conversation at the teenager. So, for example, if the parent says, "So how is Jessica doing in therapy?" I might say, "You know what, we're doing great. So far this week, what we focused on is like body image. And what do you think? It's been going okay, right?" And I'll refer to the teen. And it's taken a little bit of practice to get that down. But that way I'm never putting either the parent or the teenager in a position of conflict with one another. And I have asked clients, like when I first meet them, I say, you know, it's a bit of a tradition in my practice that we use everyone's last name. Would it be okay if I just called you your last name? And I remember you said in Ireland that would be quite odd. But in America, you know, anybody who's been on a sports team or sometimes at school, people use their last names. So in my case, you know, someone would call me Ayad, which it's kind of endearing. It's a little bit buddy. So that has a warmth to it as well. And if a kid has like an incredibly long last name, maybe just the first initial of the last name or something like that. So this is a nice way of creating a special way of relating to each other that isn't so hyper fixated on use my pronouns, don't use the pronouns.
They discourage any type of transitioning, both medical and social.
Yeah.
Medical transitioning often it can include a number of different things. There is no one size fits all, even medical transitioning process. It can include things like hormone therapies, puberty blockers, gender confirmation surgeries. And we're not going to get into the debates really around puberty blockers and hormone therapies today, because that truly could be just an episode in and of itself. But that's what medical transitioning often includes. Social transition involves clothes, names, pronouns, gender, very often gender expression, elements changing or adjusting or exploring elements of gender expression is social transition. And gender exploratory therapy discourages even that. Mm-hmm. So no form of any kind of transition is encouraged or affirmed in gender exploratory therapy. And in fact, they often cite in their research or what they present as research and their clinical guide that social transitioning is more likely to lead to someone seeking medical transition. So they're even creating this linear relationship, saying that if you allow a young person, because that's who we're talking about here, a child or an adolescent or young adult, to engage with a social transition of any kind, it heightens the likelihood that they're going to enter into medical transition. So they actively discourage all elements of transition, gender transition.
Under the guise of openness, because they believe by validating a social transition, by using a pronoun, they believe that's not open. They say, oh, well, that's closing off the range of outcomes. It's what would you say? It's circular reasoning. And
you know, I think the other thing that is really important, the other elements that they include under understanding gender exploratory therapy, that it understands that gender dysphoria emerges in a context. So gender-related distress, just like any other form of distress, occurs in a context. It seeks to understand how this person came to develop negative feelings about their sexed body or that the gender they were assigned is wrong. And you'll hear a lot of this. I really want to highlight this because it comes up over and over and over again that in gender exploratory therapy, the Venn diagram is a circle of gender dysphoria and being trans. They do not differentiate transness from gender dysphoria. Under their definitions, it's all gender dysphoria, it's all pathology. Transness is a pathologized or state, and it is not something that can exist outside of being a pathology. So I think that's really, really important when we consider how they're approaching this type of therapy. And I want to connect that back to when they stated that they're open to all outcomes. I just want people to hear what they're saying. They're open to all outcomes, but over and over and over again, their languaging and the way they approach transness is that it is something to be fixed.
They think that it's a symptom, that trans identity or gender dysphoria or gender nonconformity is a symptom of something else.
Yeah.
And they talk about a symptom of family, developmentally, developmental history, a social experience. We're going to get more into their social contagion theories in a bit, but they really think that that gender expression is a symptom.
There's lots of ways for us to find dysfunctional coping mechanisms. And gender dysphoria is arguably a dysfunctional coping mechanism that people set upon as this is the solution to my mental pain. Mm-hmm. And yet in this world, in this extraordinary world where mental distress has been weaponized into a kind of something to bludgeon people with and silence people with, it's just become a horrendous issue. And these are the most vulnerable kids. These are the autistic kids who might one day grow up to be gay or lesbian. These are really, really vulnerable kids. It's the savvy kids aren't getting caught up in this. It's the lost, vulnerable, sad kids that are getting lost.
So they believe if they can treat the other things or that this symptom will just magically go away.
Yeah. And that ultimately what they are not stating it, the ultimate goal is to remove that trans identity or the focus on gender.
Nick really picked up on this point when we were reviewing some of the clinician's guide. It seemed pretty obvious to them what the goal was and somehow implying that it's a choice.
That's not how it works. It's not about, I didn't choose to be trans. That's not how it works.
Yeah.
I chose to be myself. That's how that worked. Because I could choose not to be me, which is pretty fucking painful. I can choose that. I can choose to be someone that I'm not. People choose to do that shit every day. But to choose to be yourself doesn't mean that you're choosing a different sex because you think it's rad, because you're trying to follow all these cool social norms. Did you decide to be a woman? Did you decide to be a man? If you are who you fucking are.
I think they're also trying to buy time.
Yes, they absolutely are.
Because they talk a lot about developmental stages and they talk a lot about the lack of evidence of the efficacy or long-term studies of using medical interventions. And I think they're trying to buy time because they never talk about adults.
No, they're really not focused on adults. There are several folks who are involved in some of these organizations who have said something along the lines of, adults can do whatever they want to do. If that's how they want to live their life, they often use terms such as lifestyle choice, then that's fine. But they really, and they'll use this languaging too of watchful waiting. They use the term watchful waiting quite frequently in discussions of care for trans children and trans adolescents, and delay. So they literally have said that, or their way of understanding and what they have frankly lobbied for. And we will talk about a little about this as well, is that people should not have the access to any form of medical affirming support or treatment or care until they turn 25.
Mm-hmm.
So we're not even just talking about legal minors under 18. They are really pushing to remove and to block access for anyone under the age of 25 to receive any kind of medical treatment or support or affirming care.
Here's my plan to stop the chemical, physical, and emotional mutilation of our youth. On day one, I will revoke Joe Biden's cruel policies on so-called gender-affirming care. Ridiculous. A process that includes giving kids puberty blockers, mutating their physical appearance, and ultimately performing surgery on minor children. Can you believe this? I will sign a new executive order instructing every federal agency to cease all programs that promote the concept of sex and gender transition at any age. I will then ask Congress to permanently stop federal taxpayer dollars from being used to promote or pay for these procedures and pass a law prohibiting child sexual mutilation in all 50 states. It'll go very quickly. I will declare that any hospital or healthcare provider that participates in the chemical or physical mutilation of minor youth will no longer meet federal health and safety standards for Medicaid and Medicare and will be terminated from the program immediately. Furthermore, I will support the creation of a private right of action for victims to sue doctors who have unforgivably performed these procedures on minor children.
It's scary because we're going to talk about the actual dangers and harms that could introduce waiting until 25. And there is a reason why. And we're going to talk about the American Academy of Pediatrics, and we're going to talk about the APA and what the recommendations are based on research of why and when medical transition starts at a younger age.
And, a couple of things I do want to point out. They make it very purposeful under their number one under what exploratory therapy is not. They say it is not conversion therapy.
They say that
number one,
maybe 100 times.
They say it over and over again.
So what is conversion therapy and how is it slowly sneaking its way back into mental health and the public sphere?
Conversion therapists are back. Conversion therapy is a colloquial term, and it refers to general attempts to change someone's sexual orientation or gender identity. For a long time, some psychologists used techniques that were essentially torture, electric shocks or chemically induced nausea. Today, conversion therapy looks different. Much like talk therapy, it's with a religious advisor or a licensed therapist. For the most part, though, the underlying goal remains the same: to change who people are or who they love.
My understanding from other researchers in the field is that there may be an increase in conversion therapy for trans people in particular. It's difficult to say conclusively with the evidence that's available right now, because obviously it's a clandestine practice that people try and hide.
Initially, though, they will pretend to be on your side and that they accept you and that they're concerned for you. The goal is to get you to talk and then use what you say to hurt, shame, or gaslight you into agreeing with them. Ultimately, they want you to doubt or hate yourself so much that you renounce your gender identity and never take steps towards transitioning. They want you to believe that this is the best path for you and your family.
It's caused irreparable harm, that kind of trauma, like that trauma of being forced to be someone I'm not. That's what conversion therapy is at the end of the day. You don't get a choice.
It is slow, it is insidious, it is creeping, and it is all destroying.
None of the people I met at the conference would call what they do conversion therapy per se. Instead, it's safety, which stands for Sexual Attraction Fluidity Exploration and Therapy. Or it's reparative therapy, or even mindfulness.
Conversion therapists come in several flavors. Ones who try to convince you to stop being trans because it's sinful, ones who think that you're trans because of some sort of trauma, ones who think it's due to internalized misogyny, and ones who will try to convince you that you should just Learn to suffer untreated gender dysphoria because it makes you a better person. Figuring this out is surprisingly simple. Conversion therapists will rarely use your preferred name and basically never use your preferred pronouns unless they match your sex assigned at birth.
And one of the questions is, are you going to use their preferred name? Are you going to use their preferred pronouns? It'd be okay if I just called you your last name.
Clinicians I spoke to were adamant they could treat trans kids with a similar approach they used for gay people.
Texas Republicans recently endorsed a therapy that purports to turn gay people straight,
defending conversion therapy from an allegedly scientific point of view.
It's the understanding that same-sex behavior is an attempt to repair your childhood emotional hurts.
And gender dysphoria is arguably a dysfunctional coping mechanism that people set upon as this is the solution to my mental pain.
State's ban on conversion therapy for minors.
In Alabama, Florida, and Georgia, the federal 11th Circuit Court of Appeals ruled that banning conversion therapy violates the First Amendment.
An appellate court found that law, which stops therapists from trying to change a child's sexual orientation or gender identity, violates the First Amendment.
A ban now declared unconstitutional, according to this 2-1 11th Circuit ruling.
And in Indiana, state politicians recently passed a law preventing local governments from outlawing this practice. Separately, Nebraska now mandates minors who are seeking medical care for gender dysphoria to undergo 40 hours of therapy that does not merely affirm their identity.
In our current culture, in which children are being indoctrinated with transgender belief from the moment they're out of the womb, they are being indoctrinated into gender confusion from preschool forward. So no, with a gender confused child, the family absolutely needs our help.
As physicians and counselors begin to help gender dysphoric children embrace their bodies. If we don't stand up, who will?
It confirmed for me how a political movement that sees transness as a problem includes people who believe conversion therapy is a solution. That's who's waiting in the shadows if anti-trans extremists get their way.
What other therapies do you hear saying we're not a conversion therapy?
Right.
I don't know many others that I've been trained on.
I don't think I need
that.
to say that. I think that's pretty apparent. So, I mean, I've never had to convince someone that I'm not doing conversion therapy. So, yeah, if we're trying to convince someone, I would be curious about why that's so important.
It is not conversion therapy. And just for a little context here, conversion therapy is a term that describes a type of intervention or practice of attempting to turn homosexual people heterosexual. But what's happened in more contemporary times is that this label of conversion therapy has been applied to any type of therapeutic interaction or relationship which attempts to help a young person or any person with gender dysphoria explore what the meaning behind it could be, or anything essentially that is not a concretizing or an affirming of their stated gender identity. It conflates two very distinct practices, one being an attempt to convert a gay person to a straight person, and any attempt to just simply help an individual understand themselves better, particularly in the context of their emergent gender dysphoria.
I want to go back to Dr. Jamie because she referenced a really important distinction based on the UN Human Rights Council definition of conversion therapy. They define conversion therapy as encompassing any approach that denies, delays, or problematizes a person's gender.
We've already covered those three topics.
So, they do say over and over and over again, repeatedly, that they are not conversion therapy based on their definition, but based on someone else's, the UN Human Rights Council,
the Trevor Project,
I think they do fall under that category. There are more professionals speaking about this.
Hey, it's Dr. Jamie. My pronouns are she or they. I'm an associate clinical professor of psychiatry. I am a researcher, and I'm somebody who works in the space of gender affirming care. I thought I would talk about a term, gender exploration. This is a term I have used in a trans positive context within the gender affirming care model. However, I have recently heard that this term has been appropriated by individuals offering interventions that are not supportive and could be labeled conversion therapy. So within the gender affirming model, when we talk about gender exploration, We're talking about walking with the individual, the client, the patient, as they begin to unpack their gender. This can take many different forms. It can come in the form of supporting social transition, talking about the benefits and risks of medical transition, choices related to legal transition. There's a lot of different things that gender exploration can entail. But within the gender affirming model, the idea is that the person leading the way is the patient, is the client. It's not the provider trying to deny or question how somebody identifies.
We're definitely not the only ones pointing this out, obviously, which is why they've had to repeatedly state that they're not over and over again. But there is definitely plenty of information out there regarding why folks are identifying this therapy as conversion therapy. And I do want to note that we're going to get into some of the other organizations that are tied to this model of therapy, and at least 2 of them are designated hate groups by the Southern Poverty Law Center.
Yeah, something else that they talked about in the webinar, they use this idea of a false concept of transition. As I was taking my notes watching the webinar like a good student, and it said, quote, "It can be a false concept to believe that transition will solve all your problems."
Oh, yes, they do talk about this quite frequently.
Quite frequently, like, it's not going to solve your problems. Like, look at all the evidence that shows people are unhappy after transition. They believe in gender ideology that there's a false idea that all your problems are solved once you transition or any type of affirming practices. And I believe that this is a flawed understanding. Nick shares a little bit about how actually getting treatment earlier on could have been helpful in their life and in their experience.
The love, the support that I had in my early 30s and on, had I had that from the get-go, I can assure you that I would have been a much happier human the majority of my life. I can guarantee you that I would have far less therapy than what I have now.
I think it's fascinating because I kept finding that as a standout over and over again as I was reading, and yet they just take they go to such great pains to say that exact thing, but in support of their model. They include some case studies. Well, they refer to this person as Emma, even though this young person has requested repeatedly to not be called that. But so they refer to this person as Emma, and they have some dialogue. The therapist says, "My role is to be your therapist, not your parents' therapist. That means I'll do my best to understand your experience and treat you like a whole person. You're not just a big walking gender identity, right?" To me, it's just really fascinating. And this was one of the first things I noticed as I was looking on this right up the gate. In their attempts to minimize conversation around gender, to avoid conversation around gender, to not use pronouns, to use weird nicknames instead of names, to, all of this stuff, they've created this big boogeyman of gender. Like, they're emphasizing it most of all through all of these attempts to de-emphasize it and to ignore it and to treat it as a symptom.
Let's just talk about the therapeutic skill of that last statement. You're not just one big walking, right? That is not even an open-ended question for these people that are really into range of outcomes, and we're open and we believe in informed consent. That statement alone, right? That's not an open-ended question.
This is the same therapist that refuses to use someone's name if it's not the name assigned by their parents. That whole dynamic to me is very not client-centered. Like, why wouldn't you just use somebody's name? Like, why do you want to force calling them a nickname? It's just so odd to me.
But they also say that informed consent is one of their most important pieces, and autonomy.
Right.
They truly say autonomy.
They do.
But how is that supporting autonomy?
It's not. It's telling someone, I'm not going to call you by your name. Why don't you pick a nickname in my office? so that I feel more comfortable.
You do it.
Okay. I mean, and there are so many other issues with these case studies, like the language of using sex change and referring to someone's identity as like a part of them, like a trans part of them, and like the other parts of them that's like a real part of them. I mean, all of this is just the languaging is wild. We could pick apart this for years.
Oh, for years.
But the other one that I really wanted to highlight, which I thought was really fascinating, that they refer to as Alina. At the end, there's a summary of thoughts or progress or prognosis about each case study. One of the things in Alina's summary, the therapist writes, I hope that working through these issues, so the therapist is referring to sibling rivalry, Oedipal conflict between Alina and the father and mother. I mean, it goes very Freudian real fast.
Was that Lisa?
I don't know because it doesn't say the therapist's name in the clinician guide. But there is a lot of languaging around underlying like unconscious family rivalry, Oedipal complexes. I mean, when was the last, like, I think I wrote like, what century are we in? I know some people are still like psychoanalysts, but wow. We're really stretching to try and come up with some kind of an explanation for this individual's identity as being trans, like an Oedipal complex.
Mm-hmm.
Okay. But they wrote, I hope that working through these issues will result in a resolution of Alina's gender dysphoria and demands to transition. Their hope is not that Alina will find a path that fits for them and that they're open to any path that Alina decides is the best one for them. Their hope is that Alina will not transition and their demands will be gone. And that's it.
Exploratory therapy is open to a range of outcomes. We're actually really trying to begin a process of exploration and dialogue that will help young people understand themselves better, how they want to live, and what kind of life is actually going to be most liberating for them.
And not just seeing somebody as, often Sasha would say, a walking gender identity.
Therapists had to affirm gender identity without any question or exploration. You had to affirm.
In my place of work, where I carry out my counselling, there are posters plastered all over the wall from Stonewall, who are a particularly militant bunch. And the poster said, some people are trans, get over it. And I thought, what a way to shut down discussion and dialogue. And I wasn't prepared to get over it.
I wrote down some direct quotes again from the webinar. It fits right into that. So because they think trans identity is a subtle way to manage the stressors of being a teen and also the context in which that like presents itself inside of you, they say the therapist should be more directive in therapy and not stay out of the way of the process in the context of identity exploration. And the way that she chose to finish that sentence off by radically transforming their body, their sense of self in the world, and how they relate to others. There's this paternalistic idea that because of a child's developmental stage or certain vulnerabilities, that they can't have those opinions or ideas, or they can't feel that way, and that it's the therapist's job to tell them, oh, this is a phase. This is the vibe I'm getting. Now, I didn't get that direct quote, but the sense is they're like, this is a phase. Let's get you through it. And it's our job to be a little more direct. So I will say that that's different than a lot of therapeutic approaches, is that directiveness. Do you think that that is coming up in the case studies?
Oh, absolutely. And I think it is very directive because they have an end goal. And how can you not be directive if you have a specific end goal in your mind? And the end goal, whether they say it or not, over and over and over again in both the treatment guidelines and the case studies, is trans identity is eliminated, or at least that no transition is taking place.
Plus, there's this feeling that
gender is this exception to everything you know.
Yeah.
Everything you ever learned as a therapist, it doesn't apply to gender. So you feel very lost.
Mm-hmm.
We really believe in a kind of back to basics approach. And it's so important because when you have this emerging population with a new kind of presenting problem,
no serious country should be telling its children that they were born with the wrong gender, a concept that was never heard of in all of human history. Nobody's ever heard of this, what's happening today. It was all when the radical left invented it just a few years ago.
It's very seductive to latch onto a new, exotic, kind of novel therapy approach.
They also say language like, is this a healthy developmental call or a psychic retreat? And in their podcast, they talk a lot about, well, I had a lot of struggles as a youth. And wouldn't that have been neat to find something that's the answer to all my problems?
Stuck fantasy quality about it. Sasha already alluded as he came in with this really kind of rigid fantasy. It's like, I'm going to become a girl and then everything's going to be great. And I just need to reveal my womanhood so that, because it's like, yeah, this might be right for him. And it will probably solve some problems and create new ones, because that's just the reality of life. And so, if you're dealing with someone who's not holding that level of complexity, then they might be kind of burrowing into this kind of ideology, I guess, to avoid thinking about things or feeling things.
So when I first heard about the idea of blocking children's puberty, I literally stood still in the street saying, oh, you can't do that. That's blocking the very thing that will actually help these kids. Honestly, my puberty was harrowing. It was a train wreck. It was a terrible time. But it was what I needed to go through to come out the other side. I was invited to take part in a film actually called Trans Kids, It's Time to Talk. This is 2018. The concept of the film was just to ask, could any of the 4,000% rise in female adolescents seeking medical transition, could any of them be like me and actually be better off going through puberty naturally, having a sexual awakening, becoming a woman and becoming very happy?
There's a false belief that it solves all your problems. Like, this is why I don't feel that I connect with my peers. This is why I have severe depression. And they think it's this magic ticket or this like magical thing that gives people something to hold on to. But they say, let's break it down and figure out, well, why don't you feel like you're accepted by your peers? Why do you feel so different? Why are you struggling with social anxiety?
Well, I think it's interesting because they reference like Erikson's conflicts a lot in development and how it's also like a way to resolve identity and that identity conflict in adolescence. And I do think that there can be a potential for anything to be seen as, well, once I do this, I'll feel okay. Once I do that, I'll feel okay. Could it be that sometimes because children and adolescents think more concretely and have less developed ability to see realistic future consequences, that could come up? But I think it's in bad faith to assume that every person that walks in your door is thinking that. And I think for most children and teenagers, it does help them feel better to be affirmed in who they are. I just don't know why we have to set up such a binary of like, this is either not going to solve all your problems or it's nothing.
Yeah.
Like, of course we know that. Of course that's not true. Again, this is this false dichotomy that they're setting up and putting this on these children and adolescents, like saying that they believe this when we don't even know if they believe this. They're assuming that this is the case and this is the rationale for why all these kids and all these adolescents and young people are like walking through their door, rather than starting from what could be a more exploratory baseline, to use their verbiage.
Mm-hmm. I think that it's a really good time to get into some of their reasoning and rationale.
Mm-hmm.
So this particular clinical idea comes from the social contagion and rapid onset gender dysphoria, which are not actual real terms.
No.
Or based on evidence.
Probably some of that is social contagion. You know, it's sort of, this is the thing to do.
Got Riz instead of charisma. That's a trend. So are Stanley Cups and whatever that Paging Dr. Beat song that's all over my FYP is. But being trans, that's not a passing fad. Back in 2018, this researcher, Lisa Littman, published this paper claiming that many kids, teens, and young adults who are coming out as trans were actually cis, and they were just being misled or misinformed by social media or wanted to fit in with their friends. She coined a term for this, rapid onset gender dysphoria, or ROGD, which she used to describe the phenomenon of a young person suddenly identifying as trans due to some sort of social influence or contagion. Basically, her research suggested that the same way you feel like you need a knockoff Stanley Cup after seeing Stanley Cups all over your FYP, a person might suddenly decide that they're trans if a bunch of their friends start doing so, or if they read about it online. And Littman argued that these individuals shouldn't have access to gender-affirming care, since in her view, they aren't actually trans. But it's all based on bad science. Littman didn't survey any actual trans youth, and purposefully sourced many of her interviews from online forums for parents questioning the medicalization of trans youth. Since Littman's study was published, researchers have been unable to actually replicate her findings. The 2023 paper that relied on a survey of over 27,000 trans people across America found that whether people started to understand themselves as trans as kids, teens, or adults, most waited a very long time to tell anybody else. The median time between their personal realization and their first coming out was over 10 years. If anything, social contagion theory is the trend, not being trans.
After watching the presentation, after looking through the clinical guides, I was wondering, what do they provide that this is an evidence-based therapy? But they did not provide any specific evidence to support the gender exploratory therapy model or approach. Instead, they really just focused on outlining principles and arguing against the dominant gender affirmative model. And they didn't really share because I don't think there is any evidence around that.
Up until very recently, gender affirmative treatments were considered the gold standard treatment for young people with gender dysphoria. However, recently some questions are beginning to emerge about whether this is in fact the best treatment. And we have looked at the research very carefully in collaboration with SEGM, the Society for Evidence-Based Gender Medicine, and have also been very influenced by a number of independent systematic reviews that have been performed by Sweden, Finland, and the United Kingdom, which have all raised serious questions about gender affirmative treatment.
The presenters in this webinar said that they were working with, quote, Society for Evidence-Based Gender Medicine, which we're going to get into, and that they're working with them and using empirical evidence to support their claims that is why this could be considered an evidence-based, because they're using this particular organization's quote unquote evidence. So they did say that. And they also really cherry pick information about the risk of gender affirming treatment. So we didn't even get into that, but they go a lot into the risk of gender affirming treatments. And they really kind of just cherry pick information, and we can debunk all of that. It's against a lot of the scientific consensus. So anyhow, I just want to point out that they truly didn't produce any evidence that this therapy is actually a frontline approach.
No, it's all, they do cite many sources in the clinician guide that you can go online and download it. It's a PDF. You can access it for free. You can look at what they cite as sources in the guide. But no, it's not based on their treatment model. It's all based on prior evidence around that they picked and chosen, mostly focused on medical transition and detransition rather than how helpful their model is. They focus on how, quote unquote, unhelpful they believe other models are.
Yeah. Right. I think that's a good general overview of the gender exploratory therapy model. All right. That was a lot. And there's still more. In fact, as we continue to research and edit and look for clips, we just keep uncovering more. But as we've explored in part 1, Therapy First presents itself as a neutral and evidence-based organization offering an alternative approach in therapy to working with individuals experiencing gender dysphoria. However, as we began to uncover, their practices and principles raise significant ethical and clinical concerns, mainly around the misrepresentation of gender-affirming care and the reinforcement of many problematic frameworks. But what we came to find was that Therapy First doesn't exist in isolation. Its influence stretches far beyond its own walls, its own little group. of Gender a Wider Lens podcast. It's connected to a network of organizations and individuals that collectively shape public policy, professional standards, and societal attitudes toward gender identity and care. In part 2, we'll delve into these connections, examining the organizations aligned with Therapy First, their shared ideologies, and their impact on the broader conversation around gender-affirming care. By understanding these networks, we can better grasp how narratives about gender and identity are shaped and why it matters. We look forward to seeing you in part 2.
So as a part of this series, we wanted to do something a little bit extra. So we will also put a link in the show notes where you can purchase some merch that we have designed. We will show them here. And with these specific designs, when you purchase them, 100% of the proceeds are going to go to Advocates for Trans Equality. Advocates for Trans Equality is an advocacy and support organization that does all kinds of different work around trans rights and human rights, litigation, organizing, policy, voter engagement, name change project, ID documents, legal services. So we really want to support those folks who are on the ground in the game doing that really important advocacy work, especially as we're moving forward into 2025 and kind of looking at some very scary pictures of what future legislation is going to include. And so we would love if you would do something nice for yourself and buy a little piece of merch, and then that money will go to a good cause. And of course, if you just want to donate to Advocates for Trans Equality directly, we will put their link in the show notes as well. And you can absolutely do that. And we do encourage you to do that. If it was helpful or informative and you want to hear us talk more about these things and let us do this awful research and you don't have to, hit that subscribe button.
We'll do it for you.
And give us a rating and a review. That would be great if you are listening on the podcast, because that helps other people see that we're putting this out and maybe have access to it.
Yeah. And you can also rate or review my outfit. I wore all black for this episode because
it was
funeral.
Like,
yeah, it was like very apropos.
Dark.